Friday afternoon on protecting the health and safety of children in childcare. We're excited to get started, but we had a lot of registrants and our numbers are still climbing as people are logging in. So we're going to give them just another minute or two and then we will get going. Great. Those people. Hello again, everybody, and happy Friday afternoon to you all. Thank you again for joining our webinar on protecting the health and safety of children in childcare. Just a couple of quick logistical announcements, and then we will get started. First of all, as always, you probably noticed that you are on mute. It's not because we don't want to hear what you're thinking, it's so that we can avoid the background noise that we sometimes get on these webinars. So if you have any questions, feel free to chat them in through the chat box. There's a good chance that we won't be able to answer all of them, but it's helpful for our policy team to know what people are thinking. I will mention anything that you chat or comment into the chat box does not count as an official comment on the NPRM. We'll talk a little bit more about the official comment process later on. And I will say, we always get the question about whether or not the slides are available. They are not yet, but we're hoping to be able to post them either by the end of next week or the very beginning of the week after. So without any further ado, I will pass it over to Rachel Schumacher, Director of the Office of Child Care.
Thank you, Tricia, and good afternoon, everyone around the country. It is such a pleasure to be with you again. This is the second of our three-part series of webinars that we are doing in this new year, 2016, to unpack the details of the NPRM, National Notice of Proposed Rulemaking, that we put out at the end of last year. And this one is going to focus, as Tricia said, on health and safety. Today, I am very pleased to have with me presenting, once again, if you were participating in the one we did 2 days ago, my colleagues Min Lei from the Child Care Program Specialist here in the office, and Mary Sprague, who is also a Child Care Program Specialist here in the Policy Division at the Office of Child Care. And I am so pleased to have them here because they are wonderful, because I get tired of hearing myself talk about this, but also because they really know an incredible amount and have worked so hard to make this NPRM a reality and come about this year in a very short period of time, and have done it all before in a previous version before I came on board. As many of you know, I just started about a year ago. So thank you, Min and Mary, for joining us and for sharing the details of this NPRM that you helped produce. 2 years ago, actually, I should say, in 2014, Congress passed a bipartisan reauthorization of the Child Care and Development Block Grant. And the President signed it into law November 19th, 2014. You all know that. This, as you know, represented an incredible historic change in what the Child Care and Development Fund is meant to do and the purposes of what it is meant to do, and was a watershed moment, I think, for many of you listening on the phone who helped make it happen, and we're advocating for better care and more healthy and safe care for children and families around the country for many, many years. And as you know, it's 18 years since the previous time that this happened. So the Child Care and Development Fund has a new set of purposes, which I often start with when I talk about this. We don't have them in front of us here, but I always like to mention that the concept of promoting child development and the importance of helping more low-income children access high-quality care were added into the purposes of the Child Care and Development Fund when Congress reauthorized this on a bipartisan basis. And one of the things that I think Congress cared about in particular and spent many long hours debating and learning about and thinking about how best to do was making sure that all children who receive care, especially those paid for through the Child Care and Development Fund, are healthy and safe, and that this program makes sure to the best of its ability that that is the case. So we will talk about that more for the rest of this webinar. The webinar is going to summarize certain components of the rule. It certainly is no substitute for the full text. So please do go and see the full text in the Federal Register at this HTTP address you see before you. Next slide. So for those of you who want to know what acronyms stand for, it is a Notice of Proposed Rulemaking, the NPRM, and you're all very much aware, I'm sure, that this is a proposal that an established process by which the federal government proposes how a law will be implemented and addressed, and that the public has an important comment period, 60 days, which will come in at February 22nd of this year. And we are going to be reviewing those comments and issuing final regulations. We'll get more to how exactly to submit your comments later, with a projected final time of releasing them in summer of 2016. Now, this is a very fast proposed timeline for us, and we will continue to be working very hard, and these folks will be continuing to work very hard here, if you'll be hearing from in a moment, to make that a reality. But that does not mean we do not want to pause and make sure that everyone is very clear on what's in the NPRM and has a chance to really think about it and to submit your comments to us, and that's why we're having this NPRM today. Today's NPRM is going to focus, as I said, today's webinar is going to focus on health and safety. But the NPRM in general is divided up, in the preamble, is divided up into 4 key pieces that we really want to make sure that we emphasize and that we think that Congress intended to really focus on in their reauthorization of the law. And those also include helping parents make informed consumer choices and accessing information to support child development and providing equal access to stable, high-quality child care. We focused on that in our webinar the other day. And the last but not least is enhancing the quality of child care and the early childhood workforce. The consumer choices and quality topics will be covered next week on the 20th when we have our next webinar. So in this webinar, we are going to go over these topics here. We're going to go over the provisions, make sure folks are aware of them, talk about the criminal background checks provisions, emergency preparedness and response. Mary is going to share with us also how these provisions would apply to tribes around the country. We all have many tribal grantees who may also be listening into this, and we want to make sure that we are clear how these provisions will affect those tribes. And then we will circle around, as Tricia and I both said, to the public comment process. Now, healthy and safe is something that we need to unpack. These are some of the things that we are going to focus on here. We know health and safety provisions are really sort of a bedrock by which, you know, all the other initiatives that have been going on around the country to improve quality are really built on, and how critical it is that children are healthy and safe in their care. You know, a child who is not in a situation where they feel secure or they are able to come and be healthy and not pick up lots of diseases, or, you know, they're safety is not secured and their parents can't concentrate because they're worried about where their child is. Those types of situations are just not going to, we're not going to be able to build a really strong and high quality opportunity for children on a foundation that is not strong. So I think Congress really took this up. Many of you out there brought a lot of information to light. A lot of research has been done about what it really takes to make sure that these children are healthy and safe. And the components that will be unpacked shortly by my colleagues will really help you understand what it is and how it is that Congress came to address these issues and build on, I think, what many of you have been making the case for a long time, which is that, you know, we really can't afford to have situations where children are not safe and that their parents cannot feel that they've left their child in a place that is good for them for the day. So we're going to move on to some of those details, but we're hoping that in the future we have a lot fewer stories that make us cringe. When we hear about childcare, we want to hear about the positive things around the country. And, you know, in this office, we monitor everything that happens that is in the papers. And sometimes you have these headlines and we just don't want to see them anymore. We want to have a situation where children who are in childcare are nurtured as best possible and also are come home to their parents safe and healthy and happy at the end of the day. So everything in this law and in this NPRM is meant to make us get closer to that reality. All right, so I am going to turn it over now to Min, who will lead us off in discussing health and safety provisions in the NPRM.
Thank you, Rachel. Again, my name is Min Lei, and I'm in the policy division. Before jumping, I wanted to thank everyone for joining us on a Friday afternoon before a 3-day weekend. You are all truly dedicated individuals, and we thank you for that. So the CCDF Act, as you all know, made a lot of exciting and important improvements to the program that will help ensure children are in healthy and safe environments. This section, what we're going to try to do is kind of unpack what was in the law and what we're proposing through the NPRM. So as Rachel said, we can't go through every single thing, and we're not going to read through every detail of the slides, but these slides will be made available so you can look at them later to dig in even further. So to begin, we're going to talk a little bit about licensing exemptions. So currently, lead agencies can already exempt certain providers from licensing. What the law adds is that now they would have to describe and explain how such exemptions do not put children in dangerous settings. So that's in the CCDF Act. Through the NPRM, we're clarifying and providing a little more detail on what those descriptions must include, such as like provider setting, category, length of day, and all that is in the NPRM now. For health and safety training and standards, as you know, the Act requires lead agencies to put in place training and health and safety requirements on a number of specified topics. To clarify again, for health and safety requirements, lead agencies are still allowed to exclude relative providers from these requirements, and that's consistent with current regulations. What we do in the NPRM is we provide additional guidance and clarification, such as we added recognition of reporting of child abuse and neglect, which connects to a requirement that we'll talk about a little bit later. We also add child development onto the required training, which is in line with the revised purposes that Rachel spoke about before. Then we also define pre-service or orientation as being within 3 months of starting. That's a question that we have gotten a lot from people who have read the Act, wanting to know what exactly that period of time should be. And then we also clarify that these requirements should include caregivers, teachers, and directors. So next up, we're going to talk about the annual required monitoring. So the law requires lead agencies to have in place monitoring requirements for CCF providers by November 2016. So what this means is for licensed providers, there would be a requirement for a pre-licensure inspection as well as an annual unannounced inspection. For licensed exempt providers, they would be required to have an annual inspection. And in the NPRM, we specify that monitoring must cover at least the specified health and safety topics that are described in the in the law and elaborated upon in the NPRM. So something else that the CCDVG Act did was require the licensing inspectors be qualified to inspect those child care providers and facilities, and that the lead agency have a ratio of licensing inspectors, a ratio to providers and facilities that will allow the lead agency to conduct effective inspections on a timely basis. Now, the law specifically says that ACF cannot require a specific ratio, but we do provide some guidance and resources in the NPRM so that to help states and lead agencies as they develop their own ratios. Next, we're going to talk a little bit about what the NPRM adds as far as monitoring and implementation options. So we are proposing to allow the use of differential monitoring or risk-based approach for annual inspections. We should clarify that all providers still have to be monitored. What this does is allow for the actual monitoring inspection. The lead agency can develop differential monitoring so that what is examined during the visit is representative of the full complement of requirements, but doesn't necessarily have to go through every single one. And but as I said, all providers still have to meet the monitoring requirements. We do encourage coordination with other monitoring entities, such as licensing, QRS, Head Start, and CACFP. We've added this in because we know that there may be overlap between other monitoring entities. We should, again, clarify, and we talk about this in the preamble, that the monitoring visits still have to cover all the requirements, but to the extent that within those requirements another agency may already be checking, we encourage coordination to make sure to minimize the overlap. And finally, on this slide, we talk about how we are proposing to allow the option to develop alternative monitoring requirements for care in the child's home. And this is just in recognition that care in the child's home may be slightly different than more organized care or more formal care, but this is also an area where we are specifically asking for comment because we want to hear from you about what you think about that proposed option. So the next slide is going to talk a little about monitoring and inspection reports. We're going to talk about this in more depth on next week's webinar, which is on consumer education and quality. But since it does relate to monitoring, we wanted to touch upon it here. So the CCDVG Act requires states and territories to make the results of monitoring and inspection reports available by electronic means in a consumer-friendly and easily accessible format. What we add in the NPRM for additional specificity is that they must post full monitoring reports and a plain language version, that they must be posted in a timely manner, and that going forward, there should be at least 5 years of results posted. But again, we'll go into more depth. Megan Campbell will go into more depth on that next week. Reporting serious injury and death. The law requires lead agencies to report the aggregate number of fatalities among children in child care settings, and then also to make publicly available the numbers of deaths, serious injuries, and instances of substantiated child abuse in child care settings. What we added through the NPRM is that we're specifically requiring lead agencies to designate an entity to which providers must submit reports, and then we're adding a specific requirement that lead agencies have to require providers to report this information. Okay, the next slide is on parental complaints and response. So the NPRM would require lead agencies to describe how they will respond to complaints received through the national hotline and website. The description also, we did specify that the description must include the designee responsible for receiving and responding to those complaints for both licensed and license-exempt providers. And we will also require lead agencies to establish a hotline for parental complaints. So the law adds some requirements around child abuse and neglect. It says the lead agents have to certify in their plan that child care providers comply with procedures for reporting child abuse and neglect, which is required in the Child Abuse and Prevention and Treatment Act, otherwise known as CAPTA. In the NPRM, we add a little more clarification, saying that this applies to caregivers, teachers, and directors, and that providers should also be in compliance with other child abuse reporting procedures and laws that may be applicable in their state or service area. And if you remember from before, we also added reporting and recognition of child abuse and neglect to the list of required trainings. So again, we kind of logically think if they're going to be held to this standard, that they should be trained in it as well. The next slide talks about a few provisions that address quality and child development. So lead agencies would have to describe in their plan standards that establish group size limits for specific age populations and appropriate child-staff ratios. Again, we're not requiring any specific ratio or group size, but we do provide some resources and some guidance in this area. And then it also requires lead agencies to include required qualifications for caregivers, teachers, and directors. And through the NPRM, kind of keeping in line with the revised purposes and the new vision for this program, we clarify that these standards should promote the caregiver and child relationship in the type of child care setting involved and provide for the safety and developmental needs of the children served. So I know that that's a very quick overview. I tried to speak a little bit slower than I did on the last webinar to give people time to digest, but this next slide is hopefully helpful to try to help people keep track of which provisions apply to which provider settings. I know that each health and safety provision kind of has a different applicability. So as you can see, we have it listed by provision and provider settings. So health and safety training would apply to licensed CCDF, licensed exempt CCDF, and CCF care in the child's home. For monitoring, there are a couple different layers. So annual monitoring applies to licensed CCDF, licensed exempt CCDF, and care in the child's home. So we have the proposed option to come up with alternate monitoring strategies. And then pre-inspections only apply to licensed CCDF. And then the posting of monitoring and inspection reports would apply across the board. So I hope that this is helpful as far as just trying to keep everything in line and wrap your mind around how these requirements apply. So the next slide, I want to reiterate that we welcome and are hoping for comment on the entire rule, both positive and negative, but we do specifically ask for comment in a couple of different areas, and these are areas that where we've been grappling on the issues a lot and want to hear from you specifically. Those include the proposal to allow the development of alternate monitoring requirements for care in the child's home, and also whether the final rule should include a requirement to conduct unannounced inspections in response to complaints. So we have on our CCF reauthorization website a document with all the areas where we're specifically asking for comment, and this is just the piece that applies to this section. Now I'm going to hand it over to Mary Sprague, who will discuss criminal background checks.
All right, thanks, Min. So I'm sure you're all waiting with bated breath to listen to background checks. So I'm just gonna dive right in. So first, I wanted to start by talking about who needs a background check. So these background check provisions are a little bit different than the other health and safety requirements because we're talking about a broader population. So all licensed, regulated, registered child care providers and all child care providers eligible to deliver CCDF-funded services are required to have background checks for their child care staff members. So the law includes a definition of both child care provider and child care staff member, and I'm not going to read through them both because I know that you all are familiar with this by now, but I just wanted to note in the NPRM, we're adding or we're proposing to add other adults in a family child care home to be among the members who need a background check. So now that we've talked about who needs a background check, we'll talk about the components. So the law included a list of 5 different components, and we got a lot of questions about the components, a lot of questions about the duplication among those 5 components. And basically the short answer to that question is that there is duplication, but there isn't a complete overlap. And I could probably talk through this all day, but there's a longer discussion in the preamble, so I encourage you all to read that. In the NPRM, we did propose a few changes to those list of 5 components. So the list on this slide is what we're proposing in the NPRM. So one big change is that we're proposing that the search of the National Crime Information Center only needs to be a search of the National Sex Offender Registry. So the National Crime Information Center, the NCIC, is a database of 21 different files, one of which is the National Sex Offender Registry. And that, of all those 21 files, the National Sex Offender Registry is the only one that has information relating to the disqualifications in the law. So we felt like that's the only one that really needs to be searched. So we're proposing to limit that search of the NCIC to just the National Sex Offender Registry. The other change in that list of components is that we're proposing that a search of the state criminal repository should be a search including fingerprints. And we think that using fingerprints is important because it reduces the instances of false positives when you're doing a background check search. All right, so now to turn to the cross-state background checks. And by cross-state, I mean those 3 components, the state criminal repository, the state sex offender registry, and the state child abuse and neglect registry that need to be checked in the state where the individual lives and each state where the individual has lived for the past 5 years. So we've gotten a lot of questions on that, and so in the NPRM, we're proposing to add a couple provisions to support states as they work on this requirement. So one proposal that we have is that states have to have procedures in place to respond to other states' requests for background check results in order to accommodate the 45-day time frame that's required by the law. We're also proposing to require that states post their policies and procedures on their state websites about how another state can submit a request for background check results. And I will also say that this is an area that we're still sort of working to try to understand the intricacies and understand how it works between states. So we're specifically requesting comment on this area. So I mentioned the 45-day time frame earlier. So the law requires lead agencies to conduct background checks or to process background checks within 45 days. And we received a lot of questions in this area as well. So in the NPRM, we're proposing to add flexibility where we can. So first, we would allow prospective staff members to begin providing services to children on a provisional basis while their background checks are being processed, as long as they're supervised at all times. And while we're expecting lead agencies to be able to complete the majority of the background checks within the 45-day time frame, we're also proposing to allow lead agencies the flexibility to decide what the next steps are if the background check is not complete within 45 days. We know that there are ways for a state to speed up their background check processing within their state, particularly using things like electronic fingerprinting. So we're encouraging states to look into adopting those practices if they're not using them already. All right, and finally, to talk about the deadline for the implementation of the background check requirements. So the law requires that states implement these requirements by September 30th, 2017, and this is a delayed implementation deadline. But I also wanted to note that the law, in addition, allows for lead agencies to apply for a one-year extension to that delayed implementation. And that extension is separate from the waiver process. So states will be able to ask for a one-year extension to give them extra time for implementation if they're showing a good faith effort to comply with the background check requirements. Okay, so like Min mentioned earlier, we're really interested to hear your comments, both positive and negative, but these are some areas where we're particularly interested in hearing your experience and hearing your feedback and giving some additional thinking. So we would definitely welcome your comments on these. All right. So how health and safety provisions apply. These next couple slides are a recap of what Min and I have just been talking about. So first we have, this chart is slightly expanded from the one that you saw earlier. So it now includes background checks and also shows the difference between providers, settings, and individuals. And so since the health and safety requirements apply differently and differently in provider settings and also for individuals, we thought it'd be helpful to have this visual representation. So since Min walked through it earlier, the background check addition sort of mimics what I was saying in that it is a more broad requirement in that it includes licensed non-CCDF providers. Okay, so I think you all have seen this. I think you all have seen this chart before. This talks about the implementation timelines for some of the health and safety requirements. So these three requirements that are listed are have delayed implementation periods. And so we thought it would be helpful to look at this chart again just for your planning on how you're working on the implementation. All right, so now we're going to shift gears and talk about emergency preparedness and response. So in the law, there are two separate requirements relating to emergency preparedness and response. So first, at the state level, there's a requirement for states to have statewide disaster plans. And in the NPRM, we specify that this needs to apply to CCDF providers, but it could also apply to all licensed providers as well. And then the second piece in the law related to emergency preparedness and response is that emergency preparedness is one of the 10 health and safety standards and training areas for providers. So I'm going to talk about each of those things in a little more detail, starting with the statewide disaster plan. So the law includes a list of entities with whom states need to collaborate. The NPRM also adds to this list, so we also are including the Public Health Department as an entity with which to consult. The law also has a list of guidelines and requirements related to emergency preparedness. And in the NPRM, we also expand on that to specify that the plan should address the continuation of child care subsidies in the event of a disaster, and that also the plan should include coordination of post-disaster recovery of child care services. So now on to the second piece. Like I was saying, the law includes emergency preparedness and response as one of the 10 health and safety standards and trainings. And in the NPRM, we expanded on this slightly. So like I was mentioning earlier, the law has a list of requirements for the statewide disaster plan. So we drew from this list and are requiring providers to have these specific procedures that you see on the slide. I'm not going to read through all of them. So we thought it was important to have them in place to make sure that providers are prepared in the event of an emergency. Okay, on to tribes. So before I go into how the health and safety requirements apply specifically to tribes, I'm just going to take a step back and talk about the context, like I did on the subsea call. So this is going to be a little bit repetitive for you all. So as you all know, many of the provisions in reauthorization did not specifically apply to tribes. So before we started even working on this NPRM, we held a series of tribal consultation sessions in the spring of 2015 to sort of talk through what the potential impact of these provisions would be on tribal communities. And we learned a lot from these consultation sessions. And the big thing that I always say we learned is that one size really doesn't fit all, and that tribal communities are unique. So working with that, we're proposing a new framework for tribes. The current regulations divide tribes into two categories, exempt and non-exempt. So non-exempt tribes are tribes that have allocations above 500,000, and these tribes are subject to the majority of CCDF requirements. Tribes that receive under 500,000 are known as exempt, and they're exempt from operating a certificate program and also from the quality spending requirements. But we really didn't see how this framework would work with the requirements of reauthorization, particularly given the wide range in allocations, as you can see from this chart. So in the NPRM, we're proposing 3 different tiers of tribal grantees, with the large tribes with large allocations being subject to the majority of the CCDF requirements, and tribes with small allocations being subject to only a very limited number of requirements. And tribes with small allocations don't even necessarily need to be providing direct services. So with all that said about the framework, we think that the health and safety requirements are pretty essential, and they're core to the CCDF program. So all tribes who are providing direct services will be subject to the health and safety requirements that we've been talking about in this PowerPoint. So that would include the training and the health and safety requirements, the monitoring requirements, the background check requirements. For the background check requirements, we learned through consultation and talks with tribes that this requirement might be a little bit difficult, given that often tribes will have to work with states to complete their background checks. So we're requesting comment on this area to learn more about tribal experience conducting background checks. So like I said, we had a series of consultation sessions with tribes, and health and safety requirements were something that we talked about in depth. We had an entire consultation session on health and safety. So one of the things that rose to the top is pretty much that everyone agreed that having health and safety requirements is important. But we also talked about ways to implement the requirements that would be culturally appropriate for tribes. So the NPRM is proposing some flexibility for tribes around these areas. So in their plans, tribes could submit an alternate monitoring strategy and an alternate approach to conducting full background checks on other adults in family child care homes. So we think that this flexibility to propose an alternative will give tribes the opportunity to come up with something that is more culturally appropriate and works better in their communities, but at the same time also ensuring that the health and safety of children in child care is being protected. Okay, well, I am going to hand it back to Rachel to close us out by talking about the comment process.
Okay, thanks, Mary and Min. All right, everyone, so now you have a lot to think about in addition to all your 400-page document that you already had from the Federal Register, and we are really interested to hear what you think. And you have the comment process, some of the details. These slides are all about sort of how you submit your comments and how specific to be when you submit your comments. So this first slide is just the details about how to submit it to us, and we do really prefer, if possible, that you submit them electronically. That will make it a lot easier, although you can also submit them by mail. The next slide is around some bits of advice for you on how to make your comments very specific so that we here at the Office of Child Care can process all the comments that we're going to, we expect will receive as quickly as possible and be able to analyze them and understand, you know, who said which about which area. So when you do your comments, please very clearly identify the issues on which you are commenting, and as you can see here, the page number, the column, and the actual relevant paragraph section from the Federal Register document when you submit your comments. This will help us process all this information really as quickly as we can and do our analysis, because we, as I said before, have a tight turnaround and really know that we've been hearing a lot from the field around over the last year since the law passed about how important it is to have the final rule done, and these steps you take will help us realize that goal. The other thing that we would like to point out when we are sharing this, when you are submitting your comments, is comments are part of the public record and will be posted for public viewing. So be careful about your what you say, and your personal identifying information will be publicly accessible. However, if you do want to accept anonymous comments, you may go ahead and let us know. You have to go ahead and enter NA in the required fields when you're submitting this electronically. The other thing that we'd like to say is when folks are out there submitting comments, if it's possible, if you have a lot of other peers, friends, others that you think feel the same way, if you submit your comments all together and sign on one comment letter, that would be so much easier for us in terms of processing these. The sheer number of comments that come in will make it very difficult. There's a lot of required processes we have to go through, so we're really encouraging folks to band together and submit comments as a team rather than a lot of different form letters and things like that, because that will actually slow us down in our ability to turn this around over our projected time frame. So please take that into account. We do want to, let's see, how much time do we have? We have a little time, so we can take a couple questions. And I am just going to ask Min, I think he's ready to answer a question we have coming in right now.
Yeah, we had one question asking for clarification about the table that we put up earlier. So they're asking what the dots mean on the last row about posting results of monitoring and inspection reports. So what the dots indicate are that reports for these provider settings would have to be posted. So for licensed CCDF, licensed exempt CCDF, care in the child's home, and licensed non-CCDF, those monitor and inspection reports would have to be posted. Something else that I wanted to touch on that wasn't covered in this PowerPoint is that there are health and safety requirements around children experience homelessness and foster children. We didn't cover it because we had a whole section on it in the subsidy webinar on Wednesday, but I just quickly wanted to add that there is a requirement in the law that children experience homelessness and children in foster care are allowed to, the lead agency establishes a grace period that allows those children to receive services while they're coming to compliance with immunization and other health and safety requirements. We didn't mention that here, but that does relate to health and safety.
There's also an interesting question here we have that's really related. It's kind of a preview question to our consumer education and quality enhancement webinar, which will be next week. We have a question around, is there a requirement about exactly where the inspection reports are to be posted? Is that something that's covered in the law? And it is not, as far as I am aware, but I'm going to ask Megan if she has anything to add, being in the room.
I will say it's not covered in the law. In the NPRM, we do present kind of a single consumer education website, and those monitoring reports are one piece of that single website. And so we will discuss it more on Wednesday, and there's a lengthier discussion in the preamble about how states can work with their currently existing sites and databases to bring them into one space. But we will discuss it more.
Okay, well, you're just lucky we happen to have our resident expert, Megan, in the room. We do, so I think the question is particularly about, does it have to be in a certain agency as well, right? In addition to, does it, and that is not something that is required. That is something that states have some flexibility to figure out, but we do, as Megan said, talk about one website, so that's easily accessible for parents so that they can find this information when they're trying to make their choices about where to put their child. So one of the things that we should probably circle back on, and just now we have a little extra time to do, unless anyone has any more questions, feel free to forward them as they come in. I just want to circle back to sort of why we're all here talking about health and safety and how important it is. I know a lot of you don't need to hear this, but this is really a reaction. Congress is really reacting to the idea that there's a lot of differences across the country depending on what door you go in, what state you're in, about the health and safety requirements that apply, and there's a lot of concern about that. That there just needs to be a basic level of protection and health and safety for children, especially when the CCDBG dollars are involved, and that is something that that Congress is reacting to and really wanting to look at in this rule. The other thing in their law, the other thing that I think that they were reacting to is research talking about that, monitoring and knowing that someone might be coming in and checking out your facility and it might be unannounced is actually associated with more adherence to standards that are required. And so those are some of the reasons why these pieces are now being applied. And, it's something that is going to be a change, and it's going to be a lift. We're working really closely with our state partners around the country to make sure that they have the supports they need to figure out how best to do this. We've received a lot of questions and have been providing a lot of technical assistance to states around the issues of how do we monitor license-exempt providers. These are folks that have maybe never had someone come into their home or their facility and monitor what they're doing, and for the first time we're going to need to be doing that. And we understand that that is something that each state will have to come to terms with, the best deliverers of that monitoring, and figure out whether they have partners in the private sector to do it or whether they will themselves do it through their licensing agencies. But that we rest assured that we are working very closely with our state partners to help them make these decisions and think about the best way to use their resources and partners in their own states. The other thing that we just want to say is, once more, to thank everyone out there who's been working so hard on these issues, who are here on a late Friday to listen to this webinar on health and safety and everything you do for children and families. We have more information available on the NPRM, and also there is a cheat sheet for all the areas in which we specifically ask for comment, which is available on our website as well. So all those slides where we put up a chart and had, here's all the things we're asking, you can find that all in one place, and this one resource is that we will have on our website. It is on our website already. So there's also, what is that question about? So there's a question someone asked about alternative monitoring. So this is something that states are going to have to figure out themselves to some extent what works, because they're going to need to look at the partners that they have available to do it. But and this is something that you might be thinking about in terms of working in the child's home. So when going into a child's own home, there's different issues in terms of what you're looking for, what your expectations might be, and how to interact with the caregiver involved in that type of setting. And so, you know, we know that states are looking at a lot of different models of thinking about this. They might want to work with resource and referral agencies. They might want to work with other community-based agencies that have relationships with the parents or the children's parents or the families or the caregivers that are in that community. And so it's really important that, you know, we figure out strategies as we do this so that the providers that we have out there who care deeply about the children they're caring for and want to do the best possible job have a supportive relationship with the folks that are coming and monitoring them, and that we're actually helping everyone out there who's trying to do the best thing they can do for children and families be successful in doing that. And so we know that sometimes those strategies might look a little different than having, you know, your typical licensor come in and sort of look for what's wrong in the facility. You know, that's a kind of skill that's a little different than working with an individual who's working out of their home. So that's something a lot of people have been thinking about around the country, and we have some resources available through our National Center on Early Childhood Quality Assurance and through our National Child Care Technical Assistance Network website. So if you go to that site, you can find resources related to licensed exempt care and related to monitoring in different types of contexts. So I don't know if I'm looking to my colleagues, is there anything else that we could answer in the few minutes we have left, or should we just close it out and give people a few minutes left in their day?
Yeah, I think we can close that. Just like Rachel, I want to reiterate what Rachel said earlier and what Tricia said, that the questions that you're submitting today, we're going to take them all into account. There's a limitation on what we can answer during a public comment period, but we want to remind you that these don't count as official comments, so we encourage you, if you have thoughts, to submit them officially. But I think
we did also just chat out the link to the webinar next Wednesday on quality consumer education. So if anyone hasn't registered for that and is interested, go ahead and click on that link. This webinar and the slides from this webinar, as I mentioned earlier, we're hoping to have available within about a week. With the holiday, it might take an extra day or two. And once we have that posted online, we will send a message to everyone who registered for this webinar, letting them know that it's available. Once we have all 3 webinars online, we will send a note to our entire database to let everyone know that those are available and where they can be accessed.
Okay, and with that, I guess we'll close out today, and thank you very much for your time and all your commitment to children and families. Have a great long weekend if you're getting one.